Hey guys, welcome back to the channel. In this video, we're going to be going over the recovery trial or study which focused on dexamethasone in hospitalized patients with COVID-19. This study mainly focused on whether or not dexamethasone reduced any mortality in hospitalized patients with the coronavirus or COVID-19. Now, I'm going to be going over the abstract of the study and not the entire study for the sake of time, but just for future reference, whenever you're making a clinical decision, you want to review the entire study and all its demographics, procedures, and methods in order to make a solid clinical decision. Reading the abstract is not enough to make a full decision, but just for this video and just for learning purposes, we're going to be going over the abstract. And I'm going to give you guys my comments and some of my critiques of the study. So let's get started. And actually, I want to get started with giving a critique. First, the study is not peer-reviewed, which states here. This journal, Metrics, from what I remember it being called, this journal, doesn't really have a lot of peer-reviewed articles. So when it's not peer-reviewed, that means other institutions or other experts have not reviewed the study to assess the validity of it in order to deem it really efficacious for clinical use. So we take this with a grain of salt when it's not peer-reviewed. But let's go ahead and read the abstract of the study. So it gives a little background information. So the methods were, this is like the acronym for recovery. It was a randomized, controlled, open-label, adaptive platform trial comparing a range of possible treatments with usual care in patients with hospitalized with COVID-19. Basically, it's saying they got it randomized, meaning that the subjects that were in the study were either in the control group or the experimental group. The open label aspect is another critique I have for the study, because an open label study, the researchers of the study know which patients are in the experimental group and which patients are in the control/placebo group. So whenever it's an open label study, it gives room for bias because the researchers know, and that creates bias in their judgment of their assessment. Moving forward, we could see that the results, 2,104 patients were randomly allocated to receive dexamethasone, which is the experimental group, compared to 4,321 patients in the usual care or standard of care group. It's not really a placebo because they're giving treatment, but their treatment isn't the experimental group. They're not testing to see how effective usual care is. Now, giving my critiques while we're going over it, I don't like the fact that there were not equal amounts of patients in the experimental group compared to the control group. I would want this to be very similar. I know when you read the study, they say there's a 2-to-1 ratio between the control group and the experimental group. However, it's best to give equal amounts for statistical significance. Now let's talk about the primary outcome of the study. The primary outcome of the study is basically their main objective of the study, so what they're trying to find out. So what they're trying to find out is 28-day mortality. So they want to see within 28 days how many patients survived or passed away when they were on dexamethasone, the experimental group, compared to usual care, which was a control group. So let's go over the results. So amongst the dexamethasone group or the experimental group, 21.6% passed away compared to 24.6%. So about 3% less passed away or died in the dexamethasone group compared to the usual care or control group. Now, like I always emphasize, statistics is a major aspect when you're analyzing clinical trials or any sort of study. So here they used categorical data, they used relative risk. And so with the statistics, they said that it was a relative risk of 0.83. So it was about a 17% reduction. And so relative risk reduction in the dexamethasone group compared to the control group, with a confidence interval of 0.74 to 0.92 with a p-value less than 0.001. All these numbers are basically saying that there was some sort of relative reduction in the experimental group, which is the dexamethasone group, in patients who passed away or died within 28 days when they were diagnosed with COVID-19 that are hospitalized. And the confidence interval for categorical data, if these two values don't cross the value 1, that means the results are statistically significant. And the p-value, the smaller the p-value, which is a p-value less than 0.001, means that these results were not basically due to chance. And so looking at this data just from just this sentence, it seems that there is a statistical significance between patients who did get dexamethasone and those who did not get dexamethasone in regards to mortality within 28 days. So that's very important to note. And statistics going forward is what I usually use to really assess how valid this study was. So let's move on to the next result. So they said the proportion and absolute mortality rate reductions vary significantly depending on level of respiratory support at randomization. Dexamethasone reduced deaths by 1/3 in patients receiving invasive mechanical ventilation. So patients who were getting mechanical ventilation, like a respirator, the deaths were 29% compared to 40%, with a relative risk of 0.65, which is really good for the dexamethasone group. And let's look at the confidence interval. So this is categorical data, and so the confidence interval is between 0.51 and 0.82, which does not cross the value 1, and the p-value is very small. So we say these results are also statistically significant, and they have some validity to them. This is not saying that they're clinically significant. I want to really address the fact that there's a difference between statistical significance and clinical significance. And so these values are also statistically significant, so they have some sort of validity. And let's move on forward. So 1/5 in patients receiving oxygen without invasive mechanical ventilation was 21.5% versus 25%, with a relative risk of 0.8, with a confidence interval of 0.70 to 0.92. Again, we have a relative risk less than 1, which means there is some sort of reduction in mortality in the dexamethasone group compared to the usual care group. And the confidence interval does not cross the value 1, so it's 0.7 to 0.92, and the p-value is relatively small as well, as at 0.002. However, this is not to say that dexamethasone will make a clinically significant difference. That's for a physician or any clinician to decide that. I'm just objectively viewing these results. And let's go on to the next result. Then they said, but did not reduce the mortality in patients not receiving respiratory support at randomization, 17% versus 13.2% at a relative risk of 0.122, with a confidence interval of 0.93 to 1.6, with a p-value of 0.4. Now, this is where I want to emphasize the difference between what you're reading and what you are assessing based off the knowledge that you know. So, but did not reduce the mortality in patients not receiving respiratory support at randomization. So the study is telling you dexamethasone did not reduce or did not help patients survive who were not on any sort of respiratory support, or so they were not on a ventilator, they did not receive oxygen. If you gave dexamethasone to these patients, this results are saying that they had maybe an increased chance of death, 1.22. So when the relative risk is over 1, that means that the experimental group has a higher risk for whatever they're assessing compared to the control group. So when a relative risk of 1.22 says, oh, they have a 22% more chance of mortality when they're on dexamethasone and they don't have any respiratory issues compared to usual care. However, one thing I want to note, that's it's important to look at all aspects of statistics, is that the confidence interval here crosses the value 1. It goes from 0.93 to 1.61, which deems it statistically insignificant. Why is that important? Because they cannot conclude it did not reduce mortality. They could only conclude that, hey, this part was inconclusive because the stats did not make sense. If the relative risk was 1.22, okay, it's worse off if you take dexamethasone compared to standard of care. But then these confidence intervals should not be crossing 1. So if let's say it was 0.101 to 0.161, then this will say this is a statistically significant factor of dexamethasone increasing the mortality rate compared to usual care. But because this confidence interval crossed 1, we deemed it statistically insignificant. And the p-value is not too high, but still too high for my taste. I like it below 0.05, which is usually the standard that they go by. And so that is how I generally assess these results. Understanding stats is really boring and it's not the funnest thing to do, but once you kind of get it down, it really gives you a lot of confidence in assessing these clinical studies, because you have a sort of standard to go by. Hey, if the confidence interval crosses 1, you cannot make a solid conclusion because the stats are insignificant. So let's read their conclusion. So their conclusion is, in patients hospitalized with COVID-19, dexamethasone reduced 28-day mortality amongst those receiving invasive mechanical ventilation or oxygen at randomization, but not among patients not receiving respiratory support. So this conclusion, I agree with it for the most part. I don't agree with this statement. What if their demographic wasn't suited enough to see how much dexamethasone helps with patients not receiving respiratory support? That conclusion is not fully backed, in my opinion, and so I wouldn't say the last part of this conclusion. But overall, this study did give a lot of good insight about the possible use of dexamethasone and how it's reducing mortality rates in hospitalized patients who have some sort of mechanical ventilation or oxygen requirements. So this is how I basically review clinical studies in a nutshell. Of course, you want to read the full study. You want to learn the demographics in the study, what kind of patients, what disease states they had, because that's also some room for critique there. But just as a quick overview video of how I go over an abstract of a study, I wanted to show you guys there. If you guys have any comments, questions, or feedback you guys have for me, please leave it in the comment section below. And I hope you guys learned something watching this video. See you guys next time.